Okay, so this is a video that is for, involves breathing for the ribs. And we're using a strap here to help assist, to help guide the ribs, not necessarily force them, but guide them through both a regular breath motion, and then we'll add an actual like postural lift with that as well. And there's a number of variations you can add to that also. So the first thing is, especially if you have a specific rib or a few ribs that are really stuck, that you know to be stuck, that you can feel are stuck, and maybe they're even a little painful. We don't want to force this, especially if it's not clear if you have a fracture or not. You definitely don't want to be aggressive with this. Maybe you don't even want to do this at all if it really seems likely there could be one. So that's where you might want to get an x-ray and get that figured out first. But if there isn't a fracture and it's just stuck, what we can do is kind of scoop under here. Now, this obviously is not going to work as well if I have to go up higher here. I mean, you can do it, and it's kind of hard because the arms are in the way or the shoulder blades themselves. So you might have to do some adjusting. You don't want to be necessarily like too much on your neck here if you can help it, because the ribs aren't in the neck anyway. But I can be like maybe like T1, T2, the upper thoracic here, maybe a little bit. But it's kind of hard to get to those. Those are a little different. In fact, if it's a first rib, you may have to do something more like this to kind of pull it down and just lift the chest here, kind of something along those lines, which you can also anchor maybe more down and back that way or down and forward, whatever you need to do there. So that's another option, because there are muscles that articulate that rib as well with the breathing in and out and just take up that slack. So we're going to do the same thing. We're going down to maybe the mid ribs, a common area to get tight, stiff, stuck. And thinking about the ribs themselves, I can feel it expanded as I tension the strap, and then as I exhale, I'm going to use that exhalation as I purse the lips and blow through like I'm blowing through a straw with some resistance. Feel my ribs pull in, and I'm going to lift my chest up. So in other videos, we talked about anchoring those lower ribs back with those abdominals, because they go from the lower ribs down to the pubic bones there, basically part of the pelvis. So when we pull this down, it's going to anchor the ribs. We want to think more pull back to my back here rather than down, because I don't want my chest to come down. In fact, what I want to do there is anchor back and lift the chest up, and then I can really feel a good stretch there. But more importantly, for this video, is what I'm doing is I'm actually compressing the rib cage in as I lift and expand the chest out here, right? So really working on that area there and trying to channel that into good posture, right? The other thing is kind of think about like that expansion is kind of like winging out here, like kind of like flaps and then coming back in. And up here, it's kind of like I'm expanding my rib cage like back and then drive it through. So that allows me to kind of take my pressure here, and maybe especially if it's painful, I don't want to try to do a lot of movement. And again, especially if there's a potential for fracture, I don't want to be really being aggressive with this, but maybe just kind of cinch it up a little bit, tuck those elbows, and just think about breathe in and breathe out. Just keep a little pressure, slow, steady. So I'm kind of scooping and lifting with my pressure. So it's kind of like a shovel motion, like here, scoop and lift. But I'm not really forcing that. I'm just kind of guiding that along the spine and the ribs. And you'll feel as you're breathing with that tension, there's a tendency to kind of, it'll pull you as the ribs expand in the back as you breathe in, and then breathe out, tuck and lift. And it'll almost kind of do it itself. And you're just going to nice and easy, just gently go with that, scoop and lift. And you can try to maybe go a little higher, different ribs, right? Different segments. Nice and easy, nothing too aggressive, right? But if you're feeling comfortable and you're pretty certain there isn't a fracture, you can certainly kind of do a little bit more of that scoop and lift, like really kind of get into it. Just make sure it's okay down the lower back. You might need to make sure some of those vertebrae are moving as well. And even the pelvis itself, kind of rolling, rocking, and getting that motion down there. Make sure the whole spine can move. Complexities or, advancements maybe you can do a shift and lift. Especially if you know which side, you got to pull that, you can't see it here, but pull my knee in and piston my hip back as I shift and lift, pull my knee in, piston back, shift, lift, back and forth with my breath. Or even kind of coming across, always lifting up. So a number of different things. And again, you can work on the upper part of the rib cage as well with some of those. So hopefully that's helpful to get those ribs moving and not so painful.